So with this remote, I am going to explain the concept of the ITP, immune thrombocytopenia, which was previously known as Idiopathic Thrombocytopenic Purpura or Immune Thrombocytopenic Purpura. And the questions that have been asked is this, that why splenectomy is a second line treatment, or why Rituximab is useful for the immunosuppressives are useful for the treatment of ITP, because that is basically connected with why this disease happens. So first, the name of the disease is ITP, immune thrombocytopenia. Previously it was called immune thrombocytopenic purpura, idiopathic thrombocytopenic purpura. Now the purpura part has been removed from the name of the disease. Why? Because all patients don't have purpuric spots. So now we just call the disease immune thrombocytopenia. It was previously also known as idiopathic thrombocytopenic purpura. Now what is the problem in this disease ITP? It's a autoimmune disorder. And to understand this, that you know that all autoimmune disorder means that there is a body's immune system perceives some of body's own tissue as foreign antigen. So let's imagine for the time being that this remote is a platelet. Just for next few minutes, think like this. Imagine that it is a platelet, and you can see a lot of buttons over the surface of this remote. Just imagine this is like a platelet, because platelets also have a lot of receptors over their surface, like glycoprotein 1b complex, which binds with von Willebrand factor to cause platelet adhesion, or glycoprotein 2b3a, which helps in platelet aggregation. So anyhow, the platelet has a lot of receptors over the surface. You already know about this. What happens in this disease basically, the key reason that platelet destruction occurs is this body's immune system perceives these receptors, these buttons like over the surface of this remote. The body's immune system perceives those receptors over the platelet surface as foreign, as an antigen. And body's immune system, they produces autoantibody to destroy these receptors. So body's immune system is perceiving wrongly the healthy receptors which are expressed over a healthy platelet as something foreign, something bad, something like virus, bacteria, and they're producing autoantibody against them. So in this disorder, what we get, that autoantibodies are produced against the glycoprotein receptors like glycoprotein receptor 2b3a complex over the platelet surface. Now these antibodies come, typically IgG antibodies, and they coat those platelets because they attach with the platelet surface over this receptor. Now what happens that these antibody coated platelets, when they move through the spleen, splenic macrophages think that why these platelets are red flagged. You understand? Because there is a abnormal, these platelets are now coated with antibodies. So they would seem this thing, they would perceive these platelets as something bad also, and they would destroy them by the splenic macrophages within the spleen. So what happens in ITP, even thrombocytopenia, that one of the key reasons that the platelet count decreases in this disorder, thrombocytopenia occurs. Thrombocytopenia means penia or poverty of platelets occur because there is progressive destruction of the platelets in the spleen by the splenic macrophages. And that's why splenectomy is found useful. It's considered a second line treatment in some patients. And Rituximab, which is an anti-CD22 monoclonal antibody, the idea is also here because it is perceived that spleen only, certain B lymphocyte, they produces this antibody, IgG antibody against the platelet. So if you destroy the spleen, remove the spleen, not destroy is not the correct word, then also what would happen after splenectomy, this problem could be relieved to a great extent. That is the reason for this. So in summary, what is the main problem in the ITP? Main problem in the ITP, immune thrombocytopenia, that body's immune system, they produces antibody, autoantibody IgG against the platelets glycoprotein receptor, their surface receptor. These antibodies come and attach to the platelet surface receptor. Then when these antibody coated platelets move to the spleen, they get destroyed by the splenic macrophages. So platelets are normally supposed to live for 10 days, but they would destroy very fast by this destruction within few hours. And that would result in progressive destruction, progressive decrease in the count of the platelets. Having said that, there is other mechanisms through also which the destruction or lowering of platelets can occur. Another mechanism is that nowadays it has been found that there is also another factor which is contributing to thrombocytopenia and ITP, that is decreased platelet production from the bone marrow through some cytokine method. But the principal mechanism is definitely the destruction of the platelets by the splenic macrophages in the spleen. If you understand the concept of the thrombocytopenia, there are basically 4 ways thrombocytopenia, decrease of platelet, can occur. There are 4 principles. Principle number 1 is decreased production of the platelets from the bone marrow. Second, increased destruction of the platelet in the peripheral blood, shortened lifespan of the platelets. Number 3, sequestration. Sequestration means that normally spleen hoard 20 to 30% of the platelet. They take away 20 to 30% platelets from the peripheral blood. But in some condition, what happens? They take away too much of platelets, 90 to 100%. And that causes an artificial shortening of platelet count. And fourth is dilutions, typically seen after massive transfusion, if you dilute them with too much blood. So in ITP, the cause of lowering of platelet is basically the number 1 and 2. Number 2 means shortened lifespan of the platelets, because platelets are getting progressively destroyed in the spleen. And number 1 is that these platelets, there's also decreased production of the platelet from the bone marrow. But the number 2, which is the increased destruction of the platelet in the peripheral blood, that is the main reason. And why it is happening? Just a quick summary again. This increased destruction occurs because platelets normally express glycoprotein receptors over their surface. These glycoprotein receptors are perceived as foreign by the body's immune system because it's an autoimmune disorder. They produce autoantibody, IgG autoantibody. This IgG autoantibody comes and attaches with these platelets. When this antibody-coated platelets moves through the spleen, they get destroyed. That is the thing. And as I mentioned you, that this is the principal mechanism, principal pathogenesis of the immune thrombocytopenia. In the next session, what I would do, I would correlate this concept with the diagnosis of ITP and the typings and the new terminologies of the ITP. Terminology of ITP has now changed completely. I've discussed on that. Another thing you need to keep in mind, lastly, that normally thrombocytopenia is defined as less than 150,000 of platelets per cubic millimeter or microliter. But ITP, immune thrombocytopenia, is always categorized as less than 100,000. So it's not like just any other thrombocytopenia. The cutoff limit is less than 100,000 platelets. All these things I will be discussing on the part 2 of the immune thrombocytopenia. Thank you so much.